Beforehand, I just want to say thank you very much for this opportunity and thank you all of you for your amazing knowledge. I mean, I am really excited to learn more about your studies later on, so I will read them, really. So right now, I'm going to show you about a review article, which is called Benefits of Pedometry in the Prevention of Cardiovascular Risk Factors. I am one of the co-authors. So let's start with our overview. We're going to see about the introduction, promoting physical activity, the purpose of our review, walking with a pedometer and the acquisition of healthier habits, the impact on cardiovascular risk factors, and our conclusion. So as an introduction, we know that cardiovascular diseases constitute the leading cause of death at a global level. Also, we know that they have emerged as one of public health challenges in low and middle income countries, including mine. And also they are characterized by their early onset, and they do have like that synergic effect. That's the one that causes us so much trouble between those modifiable risk factors. So as cardiovascular risk factors, we already know that we have the unhealthy behaviors such as smoking, drinking, poor diet, sedentarism, and physical inactivity. So we just have to remember that sedentarism might be a behavior which might just have like an energy expenditure minus or equal to 1.5 metabolic equivalents. And physical inactivity might be included like those, let's say that activity that doesn't get to the regular physical activity recommendations. The other ones that we have are hypertension, dyslipidemia, overweight, obesity, and abnormal glucose metabolism. So according to World Health Organization, physical inactivity is one of the major risk factors that contributes with global mortality. And actually it is one of the 4 leading contributors to premature mortality, which they are included, for example, high blood pressure, tobacco, high blood glucose, physical inactivity, and we also have obesity and overweight. So we know, yes?
Yes, I think the slides are not moving.
Oh, really?
We are in the first slide.
Oh, geez. Well, I'm just going to do a new share. Let's see.
Yes.
Okay, I am truly sorry. I'm going to see that right now. Let me know if it is moving right now.
No.
No.
Yeah.
Okay. Still no. Just let me try again. Oh, I'm sorry.
Carolina,
right now I am being...
This is Agne. I had yesterday the same issue. You need to share the slideshow, not the PowerPoint window. First open the slideshow and then share that window.
Okay, okay. Thank you very much.
You're welcome.
Thank you. Just please, for the host, can you please give me the permission to screen share?
Just click.
Yes.
Let's see. Thank you very much, Dr. Agnes. Just waiting here. Thank you. Okay, let's try one more time. Let's hope it works. Okay. Let me see. Can you see it right now?
Yes.
No, Carolina. First open like slideshow, then Alt Tab to switch to Zoom and share that window.
Okay.
Is it clear?
I will try. I'm sorry. I will try.
It's difficult.
Yeah. Wait. I did actually, but I don't know. Right now? Yes?
No.
Carolina, stop sharing for the moment. Stop sharing. Then open PowerPoint, press slideshow. Alt Tab to switch to Zoom and
Baby,
start
Carla
sharing
Corea.
the PowerPoint.
Okay.
Yeah.
Okay. Right now. Let's see. I did just as you, well, I actually did that just as you told me, but then I'm sorry. I guess
Yeah.
I will continue this way. I actually did. Well then, let's move to, I guess we stayed here, correct? Cardiovascular risk factors? Yes. So let's continue here. So as I was saying, thank you so much actually. With regular physical activity or exercise, there are an effective primary and secondary preventive measures for more than 25 chronic medical conditions, including cardiovascular diseases. So we also have to remember that for physical activity and exercise may be used equally, but totally different. Exercise is a type of physical activity that it's planned and it's something structured as well. And it's also to help improve or to maintain or let's say, physical fitness. But in the case of physical activity, it is that activity that makes bodily movement, which involves the contraction of the skeletal muscles, but as well, we have an increase in the caloric requirements that are over. It is a response like a resting energy expenditure. So in this case, even if we know that it is associated with a significant reduction in premature mortality and can improve cardiovascular health, sadly, we have problems like, for example, the lack of motivation, the lack of time. But also, I just want to know that that's why we have chosen as well that maybe like something that it is something we do in our daily life is to be walking, like as an ideal, since it can be incorporated in daily routine. And it's practical, enjoyable, a way to modify a sedentary lifestyle and to promote health. So just to make sure it is moving, right?
Yeah.
Yeah, okay. Thank you very much. With promoting the physical activity, walking, so especially with a pedometer, can be an effective way to increase physical activity. So we know that we have learned that the combination of having step goals with prompt feedback can motivate to continue daily physical activity. So to talk a little bit about a pedometer, we know that it's a sensor movement device that quantifies the number of steps. It can be small, cheap, and wearable. It gives an immediate feedback, as I said before, and also we have to know that since its invention, it has changed a lot thanks to the advances that we have now. Pedometer, for instance, can have a lot of issues, or maybe it can be truly precise before. For example, with the slow steps, and also that we have seen that make miss some steps or make double steps. But this, thank God, has changed dramatically. So right now we have like this establishment of concrete objectives and registering the number of steps that have been seen that helps to motivate people to keep walking and actually to reach desirable regular physical activity. So actually, even small increases in physical activity can have a significant beneficial impact on the prevention of cardiovascular diseases. So the purpose of this review was to describe those benefits of walking with a pedometer in the prevention of cardiovascular risk factors. And right now, we're going to continue then with this part, walking with a pedometer and acquisition of healthier habits. So according to Liu, Chi et al., it was seen that the adherence to healthy lifestyle, it was conveying a lower risk for cardiovascular incidents. So this means that they must be high quality diet, non-smoking, drinking alcohol with moderation, and the recommendation to physical activity that we're going to see in detail later on. And there was actually shown that 14% of low risk of cardiovascular incidents, it really diminished, and 27% lower risk of cardiovascular mortality. We have to remember as well that we actually used also a pedometer since it is an objective method to assess physical activity. We have questionnaires like AGIPAC or surveys or diaries or logs. Nevertheless, sometimes they just look more to the inactive or to the sedentary time. So we really wanted to see how maybe quantifiable physical activity can help us and see how much do we need to see results. So wearing a pedometer and setting a step goal have shown to effectively motivate previous sedentary adults to increase their physical activity. And so, according to the American College of Sports Medicine guidelines for substantial healthy benefits, it is seen that at least 150 and 300 minutes per week of moderate physical activity. I'm sorry, I don't know, is someone walking over there?
Can you mute your Dr. Mohammed, can you mute your mic, please? And the host make mute. Carolina?
Let me see. Actually, I don't have that option.
Please, could you just have that unmute or everybody except Carolina?
Yeah, I'm sorry, I don't have that option in here with me.
Yeah, me too. Yeah, no, it's fine actually. Maybe you can carry on. Sorry for that.
No, don't worry, it's okay. So in that case, we know that the recommendations are 150 or 300 minutes per week of moderate physical activity, 30 minutes in 5 days per week or 50 minutes in 3 days per week of aerobic exercise. So in that case, this study with Tudor Lock, they wanted to see like the relation between the step counting and the time that was appropriate for regular physical activity. So as you can see, there were 3,123 participants from 85 years of age. And they use actually the Actigraph AM7164 accelerometer in 7 consecutive days. And actually, they could see at the end that approximately 8,000 steps a day, they were equal to 30 minutes of daily moderate to vigorous physical activity, while 7,000 steps a day, every day of the week, they were equal to 150 minutes of weekly moderate to vigorous physical activity.
Concentrate on this. Dr. Mohammed, sorry. Your mic, please. Sorry for that. Can you just mute your mic?
No, really, I'm sorry too, because I can't do much either, but don't worry, it's okay. Yes, I do.
The only thing you said is like, yeah, Dr. Mohammed, can you just please mute your mic, please? He's not listening.
Yeah, no, it's okay. It's okay. So if there is no problem and you are hearing well, it's okay. I will try to talk a little bit louder. So how many steps are enough? In this case, in Japan in 1969, there was actually a company that was selling Mampo Ke, which actually is the meaning of a pedometer, but it also established the slogan of 10,000 steps meter, that 10,000 steps were like the number of steps that you used to do, so you can like view changes in yourself. Nevertheless, those benefits have been obtained with less number of steps, so everything has changed actually. So I'm sorry, these are the joint terms. But so in this case with Lee et al., they did a prospective cohort study which included 16,741 older women, and the steps per day were measured over 7 days using also an accelerometer with a follow-up of 4.3 years. So they got to see that an average of 4,400 steps per day was associated with a 41 reduction in mortality rate, compared with approximately 2,700 steps per day. So actually, they could see that even if they didn't reach the goal of 10,000 steps, there were actually pretty good changes. And actually, this study also helped to understand give some courage to those people that that goal of 10,000 steps was something unattainable. So with healthy diet, we also wanted to see that it's better 2 than 1. In this case, is to research on the effect of combined dietary and physical activity interventions on cardiovascular events. And it suggests that there may be more benefit than with either intervention alone. So in this case, with Oftedal et al., in this case in Australia, they wanted to see the associations between step count, self-reported diet quality, restless sleep, and all-cause mortality in 1,697 adults aged 55 to 85 years. They used the pedometer DDG walker 7 days with 9.6 years follow-up. And they saw that as they were advancing and taking an increase of 1,000 steps as years did go by, they could see also it was associated with a 7% of low risk of all-cause mortality, as well with the higher diet quality score that was being assessed every week. And it could see also a low risk of 14%. So as to continue with, also this is a study that I liked a lot about smoking. There's a program called Quitline, which consists of being called by weekly or even monthly. And it is a guide to help give people to stop smoking. It is also for people that can afford for rehabilitation in itself. So it's actually quite helpful. Nevertheless, they wanted to know how it was to use it. For example, the physical activity quantified by pedometers as one of the primary smoking urge management strategy. So they divided it into 2 groups, the step up to quit group, which one had the pedometer, and the other one was the smoking cessation counseling, that was the control group. So actually, as you can see, they started this intervention 4 weeks before the quit day of smoking, then continue and did a follow-up for 1 week after the quit day, and 1 week, I'm sorry, and then 1 month after the quit day. And as you can see here, for example, in the week 4, it could see that step up to quit, the percentage achieved step goals were, for example, the goal were 7,500. And you can see that the intervention group had more steps, and it actually continued in week 1 and in 1 month as well. Also, in the number of steps per day, you could see that it was also a big change as well, and it actually maintained. And even if at the end they couldn't establish like a concrete conclusion, but it was also like a big step to know that people that had such unhealthy behaviors, you could see that with a little bit of motivation and exercise, they could like little by little be getting away with those behaviors and help them a lot. So in this case, we're going to talk right now about the impact of cardiovascular risk factors, and we have what we know is hypertension. So an interesting term is about post-exercise hypertension, which was thankful for Dr. Fitzgerald in 1981. It's a quite interesting study actually. And it showed that an immediate reduction in blood pressure that occurs after an isolated exercise session and persists for up to 24 hours after exercise. So we have to remember that regular exercise is universally recommended as a first-line antihypertensive lifestyle therapy. And we have actually, it's a study by Kobayashi et al. It included 44 sedentary normotensive male Japanese volunteers with normal BMI instructed to wear a pedometer for 50 days. And they divided a group by more of 8,000 steps per day and less than 8,000 steps per day. So as you can see, the average with more steps per day were 9,960. The less were 6,462. And they were actually significant changes in triglycerides and systolic blood pressure. But actually in less than 8,000 steps per day, there was no change at all. So they were wondering because they look also the biochemical parameters, and within them, there was the molecule of adiponectin that we're going to discuss later on. But they saw that walking with a pedometer, they did improve systolic blood pressure and triglyceride levels, but had no effect on serum adiponectin levels. So there was quite a question about it. And before moving on to that, I'm just making a little resume about walking-based pedometry in the vascular control. So we have to know that regular aerobic exercise, which inside of them can be walking, is a known stimulus for nitric oxide production. So actually we know that nitric oxide serves as a mediator of endothelin-1 production with a potent vasoconstrictor. So in this case, we have a diminishing systemic vascular resistance. There is no, to see that there's no concomitant increase in cardiac output. Also, we know that it improves endothelium-dependent vasodilation. I actually like this, which says regular aerobic exercise independent of weight loss and changes in diet has been shown to improve it in overweight and obese adults. We also have to improve nitric oxide viability and production, which give us this huge cascade. And also we know that is lowered in the endothelin-1 mediated vasoconstriction by the reduction in sympathetic activity. And actually it has been shown that exercise can influence sympathetic activity. So we have also this study that I like a lot too. It's Hassan et al. It's a quasi-experimental pre-test, post-test study in which included 52 young women. Actually, they were divided by their BMI. So they were the normal BMI group and the high BMI group. And each participant wore a pedometer for 9 consecutive weeks. So we could see that the average number of steps were 7,056 steps per day. And actually the normal BMI, they have more steps. But nevertheless, there were no significant changes in systolic blood pressure and diastolic blood pressure volumes. So you can see here there was really no significant change at all, but they were probably because all participants were normotensive in one of the explanations. So we have to remember as well the law of initial values that, the blood pressure will be lowered to the greatest levels among those with higher resting blood pressure. And so returning to this case, with overweight and obesity, a higher BMI, we know that is associated with a lower intensity of effort and amount of physical activity. And that restricts them to achieve the effort parameters recommended to control weight and improve cardiovascular fitness. But we know that the changes that have been made with aerobic exercise with light or moderate intensity, they have been shown. So in this case, even if they had reported the normal BMI, a higher number of steps, you could see that there was not even more changes, but maybe that was because they did have almost a regular daily physical activity. So they need a more intensive exercise so we can see those changes. But in the case of high BMI, it was demonstrated a significant reduction in BMI, in body mass index. Also, it was shown the reduction of the body fat mass, the percentage of the body fat, and the waist circumference. Also, the visceral fat area. And it was truly significant. So in this case, even a trivial increase in the number of steps was able to have a positive impact in the biochemical parameters and a significant reduction in obesity measures and central obesity. So returning to Kobayashi et al., that was not finding a significant effect on lipid and adiponectin levels except triglycerides. Also, they might be because all of the patients have a normal BMI. But in this case, I just wanted to talk a little bit about the adiponectin molecule, which these two studies wanted to see. So we have to know that it is an endocrine factor synthesized and released mainly from adipose tissue. It is markedly decreased in obesity, and it's inversely correlation mostly with the visceral fat area, with the waist circumference most of all. It is an insulin sensitizing, anti-atherogenic, vasoprotective, and an anti-inflammatory. And actually in Hassan et al., you could see that the high BMI group, they had changes in the adiponectin level because they had changes too in these parameters, in the anthropometric parameters. Also, the insulin serum had a reduction and the triglycerides as well. So such changes in the participants may have been due to higher absolute energy expenditure despite lower daily steps count. And as for the abnormal glucose metabolism, in adults with type 2 diabetes, self-reported regular walking leads to a greater than 40% reduction in both mortality and regular event rates. So we have these two studies, that's Gupta and Fayehun. In this case, there was a randomized controlled trial with 275 participants with either type 2 diabetes mellitus or hypertension. And they aim to achieve an increase over baseline values of 3,000 steps per day over 1 year for the intervention group. So the intervention group was given a pedometer, while the control group was given only the daily physical activity recommendations. And they could see actually that the improvements, if both, it was the hemoglycosylated hemoglobin with a reduction of the 0.38% and the insulin resistance, a reduction in 0.96 with the homeostatic model assessment of insulin resistance. But even though they wanted to be like more, to increase more 3,000 steps per day, it didn't. The 100% of the participants, only 20% completed that goal of steps per day increase. And still we could see those changes. So in Fayehun et al., it was a randomized trial with 46 adults. In this case, they wanted to examine the effect of the 1,000 steps per day prescription on glycemic control of patients with type 2 diabetes mellitus for 10 weeks. And the intervention group was given to accumulate the 10,000 steps, and the control group was to maintain normal activity. So in this case, the end line of the hemoglycosylated hemoglobin was lowered to 0.774% in the intervention group. And actually the average daily step the daily step count was about, for the intervention group, was 6,507 steps per day. And this one for the control group. And still, even if they didn't reach the 10,000 steps, you could see the changes as well. So despite a small increase in the step count and non-attainment of the 10,000 steps day goal, there was still a significant reduction in the line hemoglobin. I'm sorry, it's hard for me to pronounce it. And improved glycemic control of participants. So increases in physical activity that are below the recommended moderate level are still beneficial to health. And we have to tell the patient as well that we have to encourage them to begin with the physical activity that they're comfortable with, but the important is that they have to begin with it. And so as it may be progressing to higher levels, it can even go to those recommended levels that are given, for example, by the American College of Sports Medicine. So in this case, the aerobic exercise may increase insulin sensitivity without a measurable increase in the maximum consumption of oxygen volume. And it has both acute and long-term effects on the insulin sensibility. So that's why walking by pedometry is an effective method to prevent type 2 diabetes and metabolic syndrome. So as a conclusion, we have that walking with a pedometer is ideal since it can be incorporated in the daily routine. It is effective to motivate changes in lifestyle, since we have seen, and it is the aerobic exercise by choice to initiate physical activity to those patients that are sedentary or that have a high BMI. Since the positive effects can be visible with light intensity exercise, and it is not necessary to achieve the 10,000 steps just by start. So some physical activity is better than none, and really thank you so much for your attention. Thank you.